Assalamualaikum. On behalf of Ahsan Academy, let me welcome you all to a presentation on the neck organs. This presentation will include the digestive organs only. Let us fix the objective. We will first have a conception of the visceral compartment of the neck, and then we will discuss the digestive organs present in the neck. You can see the photograph. The section of the photograph shows the distribution of deep fascia in the neck, and the visceral fascia includes a cylindrical area that contains the organs of the neck, and this is known as visceral compartment. This contains the digestive organs, the organs of the respiratory system, the thyroid gland, salivary glands, and the tongue. Actually, we will discuss the organs present in the head and neck region together. Digestive organs present in these regions include the mouth or oral cavity, then the pharynx. The yellow color line is indicating the distribution of the pharynx, and below that is the esophagus. The oral cavity extends from the lip, you can see the lip, and to the palatoclosal fold that extends. There's a mucosal fold that extends from the uvula to the lateral wall. Oral cavity comprises of oral cavity proper and the vestibule. The lip is a fleshy muscular fold. If we see the sections, we'll gauge the microscopically, we can identify the epithelium on the inner part and the skin on the outer part. Just under the skin and epithelium, there's layer of connective tissue, and inside in the central part is occupied by the muscles. The epithelium is stratified, squamous, non-keratinized in the inner part, but outer part will get epidermis and dermis. The oral cavity has outer part vestibule. You can see the change in color in the diagram. This reddish color area is the vestibule. So it is externally bounded by the lip and the cheek as shown in the figure, and the inner boundary is formed by the gum and teeth. Here the most important feature is the opening of the parotid gland. It opens on a papilla. You can see the papilla, and tip has a small opening. This duct opens into the vestibular cavity on a small papilla and opposite to the upper second molar tooth. You can see in the figure the position of the oral cavity and the vestibule and the opening of the parotid. The oral cavity proper has the roof, the floor, the lateral boundaries, and the posterior opening. The anterior opening is between the lips. The roof is formed by the hard palate and the soft palate. The arrow is indicating the palates above, and if you see the section, you can identify the soft palate and hard palate separately. Uvula is a tongue-like projection from the posterior part of the soft palate. The oropharyngeal isthmus is the posterior opening, and this connects the oral cavity with the oropharynx, and this is bounded in the central part by the uvula and on either side by the palatoglossal arch and inferiorly by the dorsum of the tongue. The change of color is indicating the oropharyngeal isthmus. The floor of the mouth oral cavity has some features that if we see the undersurface of the tongue, we will find a median mucosal fold. This is frenulum linguae. This is a median mucosal fold, and in the floor of the mouth we'll get a sublingual fold, and at the tip, at the medial end of the sublingual fold, there is an opening, and a small papilla is there. This is sublingual papilla, and it contains the opening of the submandibular duct at the tip. The sublingual fold has series of openings of sublingual glands. That openings, number of the openings varies from 8 to 20. You can see the floor of the oral cavity. The first arrow is indicating the frenulum lingui, and this is the opening of the submandibular gland, and this is sublingual fold showing some openings of the sublingual gland. Tongue is a muscular organ covered by the mucosa present attached to the floor of the mouth, and anterior part is free. This tongue has root, apex, a curved dorsum, and an inferior surface, and we can describe the anatomical features on these areas. The root of the tongue attaches the tongue to the hyoid bone and the mandible by some muscles who are extrinsic in nature. This is the dorsum of the tongue showing some features. This is the V-shaped sulcus, sulcus terminalis, uniting posteriorly at a point where there is small depression called foramen cecum. This is the median furrow present in the anterior two-thirds of the lung in the midline. This is indicating the posterior one-third, which is called the pharyngeal part, and the anterior two-third is the oral part. Oral part contains is irregular mucous surface with very small projections. These are papillae, and maybe of four types. This is the fungiform, this is valate papillae, this is filiform papillae, and foliate papillae. These are the four types of papillae present in the tongue. On the dorsum of the tongue, there are swellings, small swellings indicating the presence of the lingual tonsil under that. This is the position of the palatine tonsil. This is in the tonsillar fossa, in between the two folds, palatoglossal and palatopharyngeal folds of mucosa. Here in these two figures, the gross features of undersurface or ventral surface of the tongue are shown. Say this is frenulum linguae, already conversant. They are the two veins on either side of the frenulum. Bluish color line is visible under mucosa. These are the deep lingual veins, and on either side of the vein there are irregular mucosal folds. This is plica femori. Let us discuss the histological structure of the tongue. This is a section of the tongue showing different layers. The outer layer is the mucosa. Mucosa comprises of lining epithelium and lamina propria. Lining epithelium is stratified squamous, as it is having some degree keratinization on the dorsum and non-keratinized in the ventral surface. The dorsal surface shows many mucosal epithelial projections that contains only the epithelium, some has projection lamina propria inside. These are the papillae. This under surface is smooth and papillae are absent. Lamina propria is loose connective tissue. Inside there is skeletal muscle in different directions. So we'll get in section the skeletal muscles oriented in different directions. So we'll get the longitudinal section, transverse section, and oblique section. The figure is showing papilla. This is the valate papilla. This one is the fungiform papilla. This is filiform papilla, and the side, this is foliate papilla. Let us discuss the papilla one. Valate papilla is also known as circumvallate papilla, and these are the largest of the all four types of papilla and grossly visible with the naked eye. This is about 1 to 2 millimeter in diameter and usually 8 to 12 in numbers. You can see it is oriented in line in front of the sulcus terminalis, the V-shaped sulci. Sulci. You can see the sections of the valate papilla. This is having a wider superficial surface and narrow base, and on either side it is surrounded by the deep cleft. The wall of the valate papilla contains the taste bars, and in the deep cleft, the von Ebner's mucosal salivary glands opens into the floor of the surrounding cleft. These are the sulcus you can see in the section, histological section. Taste bars are shown by the fungiform papilla are relatively numerous, and it is present all over the areas of the dorsum of the tongue anterior to third. They are reddish rounded head and maybe even up to 1 millimeter in diameter with a narrow base. They're visible as a discrete pink pinhead. This mostly present near the apex and margin of the tongue. Elsewhere, it is scattered. Filiform papilla are the most numerous form of capilla, spreads all over the dorsum of the anterior two-thirds of the tongue, and these are the minute conical projections with a pointed tip. They are located in the anterior two-thirds, forming it a velvety appearance. Foliate papilla are restricted to the lateral side of the tongue, and it is near the uh, sulcus terminalis. They are ridges, and in between ridge there is groove. They are present on the posterior part of the margin near the sulcus terminalis, and these are very rudimentary in human and prominent in some animals. Tongue has two types of muscles symmetrically present on right and left half and separated by a median fibrous septum. So these muscles may be intrinsic and extrinsic. Intrinsic muscles are longitudinal muscles, transverse muscles, and vertical muscles. Longitudinal muscles are oriented superiorly and inferiorly. The extrinsic muscles includes the genioglossus, hyoglossus, styloglossus, and palatoglossus. The very name indicates the extension of the muscles from genial tubercles to gloss tongue, hyoid bone to tongue, styloid process to tongue, and palates to tongue. Tongue has motor supply as well as sensory supply. The motor supply, all the muscles are supplied by the hypoglossal nerve, the cranial nerve, except the palatoglossus. This palatoglossus is supplied by cranial part of the accessory nerve via the pharyngeal plexus. Sensory supply has two distinct areas, the anterior two-third and posterior one-third. The anterior two-third has general sensation from the lingual nerve, and the taste is from the chorda tympani nerve. The lingual nerve comes from mandibular division of the trigeminal nerve, and chorda tympani comes from the facial nerve. The valate papilla is supplied by with the posterior one-third, though it is situated in the anterior part. This posterior part, the sensory supply is from the general sense and taste from the glossopharyngeal nerve, and also it includes the valate papillar nerve supply. And taste of the posterior most part is taken by the internal laryngeal nerve to the superior laryngeal nerve. Here you can see the nerves in the figure. I'm indicating by the labeling. This is the hypoglossal nerve coming from the posterior part. This is the lingual nerve uh, coming from the mandibular division of the trigeminal nerve. You can see this is the mandibular division, and this is the lingual nerve coming from the trunk of the mandibular division. Glossopharyngeal nerve is coming from above. And this is the chorda tympani nerve. It is arising from the facial nerve. Chorda tympani nerve comes very close to the middle ear and unites with the lingual nerve to supply be distributed in the tongue. Pharynx situated behind the nasal cavity, behind the oral cavity, and behind the larynx. It is a funnel-shaped musculomucosal tube, and it extends from the base of the skull and continues below as esophagus. The lower border of the cricoid cartilage is the junction between the pharynx and the esophagus. This is at the level of 6 cervical vertebra. Total length is about 12 to 14 centimeter in adult male. It is situated behind the cavity of the nose, cavity of the mouth, and behind the larynx. You can see the color change. It's indicating the pharyngeal cavity actually. Pharynx is related superiorly to the body of the sphenoid bone, forming the base of the skull and the basilar part of the occipital bone. These are shown by arrow. Anteriorly, it is related to nasal cavity, mouth cavity, and the larynx. I have said it earlier slide. This is the nasal cavity and the junction, nasal opening, and this is the oral cavity and the opening, and this one is the larynx. Posteriorly, it is related to the buccopharyngeal prevertebral fascia, a part of the deep fascia, and the space between them. Laterally, the carotid sheath and its contents are related to the pharynx. These are the gross relations. You can see the different parts of the pharynx: nasopharynx, oropharynx, and laryngopharynx, also known as the hypopharynx. This nasopharynx extending from the posterior nasal aperture below the base of the skull, and it become continuous at the level of the free edge of the soft palate. This from the free edge of the soft palate, oropharynx runs and it extends up to the upper border of the epiglottis. So from the upper border of the epiglottis, laryngopharynx starts and lies behind the larynx and become continuous with the esophagus at the level of lower border of the cricoid cartilage, which is at the lower border of the 6th cervical vertebra. Let me discuss some anatomical features in the wall of the nasopharynx. You can see the labeled one is the pharyngeal tonsil. It is at the junction of the roof and the posterior wall. Under the mucosa there is accumulation of the lymphoid tissue and is known as one of the tonsil of this region. So this is nasopharyngeal tonsil. The lateral wall of the nasopharynx has one deep opening. This is the nasopharyngeal tube opening, Eustachian tubes opening, medial opening, and it is surrounded by a mucosal elevation which contains the lymphoid tissue, and this lymphoid tissue is known as tubal tonsil. The marking shows the upper and posterior part of the margin, and above this margin there is a deep depression that is known as pharyngeal recess. Below the tubal elevation extends into the lateral wall of the pharynx. This is known as salpingopharyngeal fold. One clinically significant structure is the adenoid. This is actually nasopharyngeal tonsil which is enlarged because of some immunological reaction. So this enlarged nasopharyngeal tonsil is known as adenoid. This can obstruct the airway when it becomes very large and compel the persons to have a mouth breathing. This creates some health problem, so it is a concern of the doctor. Clinically, most important tonsil present in the oropharynx is the palatine tonsil. This is also known as the tonsil. It is situated in the triangular fossa. This is known as tonsillar fossa. This is bounded anteriorly by the palatoglossal fold and posteriorly by the palatopharyngeal fold. Anterior wall of the oropharynx is shown in the figure. Say it comprises of the dorsum of the tongue and anterior surface of the epiglottis. So this is having several features. The lingual tonsils are the small numerous nodular swellings in the dorsum of the tongue, and the posteriorly is the epiglottis. The epiglottis is connected to the tongue by mucosal folds. This is one median glossoepiglottic fold and two lateral glossoepiglottic folds are there. Epiglottic vallicula is shown by the arrows. This is between these median and lateral glossoepiglottic folds. Laryngopharynx has some important features in the anterior wall. One median opening is there. This is known as laryngeal inlet. It is through this the oropharynx is connected to the larynx. Lateral to this opening are two important depressions. These are known as pyriform fossa. Clinically, these two fossae are very important. You can see the pyriform fossa on either side of the laryngeal inlet. The pyriform fossa is clinically very important area. It is situated on either side of the laryngeal inlet, and deep to its mucosa lies the internal laryngeal nerve. In case of foreign body impaction here, the laryngeal nerve may be injured. This is actually common site where the fish bone and the small bones are impacted. Wilder's ring is an immunological important structure. These are series of tonsils situated around the entry points of the alimentary tract. The lymphoid tissue is situated just under the mucosa, accumulates there to form a series of tonsils that makes a ring around the initial part of the digestive and respiratory tract. They made up of anteriorly the lingual tonsils series, then laterally the palatine and tubal tonsils, and posteriorly the pharyngeal or nasopharyngeal tonsil. Pharynx shows some epithelial change in different parts, and it has some relation with the larynx. So it's a larynx and respiratory tract. Actually, the nasal cavity is lined by pseudostratified epithelium which continues into the nasopharynx, but in the oral cavity and the oropharynx having the similar epithelium in non-keratinized stratified squamous which continues downward in the laryngopharynx. The larynx has different epithelium. Most of the part is lined by pseudostratified epithelium except over the anterior part and upper part of the posterior surface of the epiglottis and these folds over the laryngeal folds, this vestibular fold and the vocal fold, this is stratified non-keratinized squamous epithelium. So epithelium is non-keratinized over the nasal cavity except in the roof, which is having olfactory epithelium, and the anteromost part, which is non-keratinized stratified squamous. This stratified squamous is again present in the oral cavity oropharynx. This is non-keratinized in nature, and the similar epithelium is on the anterior surface of the epiglottis, dorsum of the epiglottis up to the upper half, and over the folds in the respiratory tract larynx. Rest of the part of the respiratory tract and the nasal cavity and the nasopharynx lined by pseudostratified epithelium. Thanks for remaining with this presentation.